Hi, well, here we are again with another topic that we hope is going to catch your interest and be educational for you. I am Dr. Rutherford, for those of you who may be tuning in for the first time. I am a functional medicine practitioner. I'm a certified functional medicine practitioner here in Reno, Nevada. Dr. Gates, my compadre here, is a board certified um, chiropractic neurologist. I always want to say functional neurologist because really that's
That's what it is, but
that's really what it is.
technical.
But the technical term is a chiropractic neurologist who practices functional neurology. And together we have put together protocols that are designed primarily, I guess, for chronic problems, chronic disease, chronic pain, or at the very least, that's the group of patients that we have developed, and we're having pretty good success with it overall. We like to share our realities of what's going on, what's working, what's not working. And today's topic is adrenals, not the only target. That wasn't the topic. That wasn't that wasn't what I was going to call it. I was going to call it adrenals, the wrong target. And we'll kind of go over that as to why that might be the case. Maybe not the only target is more accurate, but I have a sensitivity towards the adrenals because back in the 80s I took over a small practice that was I'm a chiropractor. I'm a chiropractor 35 years now, I think. 34 years, 34, 35. And anyway, and although it was a musculoskeletal practice working with necks and backs, for about 5 years, I did quite a bit of nutrition. Probably a half to two-thirds of the practice was nutritional. And I wasn't really satisfied with a lot of tools that I had to work with back then. And I won't get into those because that could hurt some people's feelings because a lot of people are still using those tools. But so I kind of morphed out of it. But one of the things that I was taught back then in the early 80s and apparently late 70s is can't fix the adrenals, you can't fix anything. It is like the mantra of alternative care. And I'm not sure if we're alternative or not. I mean, we're put in the alternative field because we're not medical doctors, even though I practice functional medicine. That's just what it's called. But in the end, I kind of feel like we're kind of like in the box of what we do for chronic pain and chronic diseases because we do work in an integrated fashion. We do have a medical doctor, osteopath specifically, a couple of osteopaths specifically that work with us in different areas. And maybe 20% of our patients require some sort of medical intervention combined with the non-medical or the natural approaches that we take to the brain and to the physiology. So so I mean I don't want to call the adrenals the alternative thing, but in the alternative world, that's like the mantra. That was the mantra when I was doing nutrition back then. Now. Started up again years ago after I got pneumonia and had a bunch of issues going on. I must tell you, the adrenals were not my biggest problem. You can know that from I mean, I like 8 concussions. I used to say 7, but we just remembered now 8 concussions. I have celiac. I have name it. Fibromyalgia, peripheral neuropathy. That's how this whole thing started. Was me getting that and then engaging some of the finer people in the country, who knows, maybe in the world, who had already been started working on this. And their position was not that it was the adrenals. Not to say adrenals aren't important, but I'm still having people come in today and go, I'm adrenal. I got my adrenals, my cortisol levels, my adrenals, I have my salivary index, and I'm taking adrenal supplements and I'm taking adrenal shots and well, how long are you going to be taking those? Well, I stopped taking because they're expensive. It was like $100 and I'm taking them one a week or several a month or whatever, things of that nature. So that whole background is what leads me to say maybe the adrenals are the wrong target to start with. Certainly adrenals have a lot of, they can have a lot of effect on chronic problems. But frankly, in our paradigm, frequently they're one of the last things we address. And other times you address them somewhere maybe in the middle of our protocol, and sometimes you'll move it up front depending on the case.
Yeah.
Dr. Gates manages pretty much all the cases that we do now here, and that's why I'm deferring to Dr. Gates. So let's talk about this adrenal gland. So, because it's big, everybody comes in seems to be aware of it. We'd like to share with you what we have found on it, and we're not anti-adrenal gland or pro-adrenal gland. We're pro people getting better. And for those of you who are out there taking adrenals, you might be wasting your money. You might not. If you're taking it and you feel better, that's fine. But the adrenals are pretty recuperative. And it may be that you don't have to take these shots or take these supplements for the rest of your life. And it may be that you do. But we'd like to bring some clarity to that. So the adrenal glands, why don't you go over why do we have adrenal glands?
So we have adrenal glands to keep us alive if we're fasting out in the desert.
Okay, that would suggest that if we don't fix the adrenal glands, then you don't fix the adrenal glands, then you can't get the person better.
Even though we live in the desert here in Reno, Nevada, most of us are not fasting. Most of us are not starving for 30 days on end. So the purpose of the adrenal glands primarily is to keep our blood sugar up in times when we're not eating. Now the adrenal glands have a host of other functions, namely if you chop an arm off, you'll secrete several chemicals from the adrenal glands that will save blood volume, things like that, in an episode of an emergency. But really for most of us in a day-to-day American life, the adrenals are about maintaining blood sugar and stress hormones. And so that's what I
was going to say. Nobody comes in here knows that they have that has to do with, well, very few people come here knows that has to do with the blood sugar.
Yeah.
Most people know the adrenals as stress glands. Why is that?
Why is that? Because I think people are becoming more cognizant of the stress response that many Americans are exposed to. Thank goodness to the work of Dr. Robert Sapolsky. We quote him almost every week. And
we probably haven't quoted him for a month now.
Okay, well, we quoted him for a week for about 20 straight weeks.
Yes.
And he wrote the book Why Zebras Don't Get Ulcers, which was a fantastic book, probably the best lay interpretation of dealing with stress and stress physiology in a human being that American can read or anybody across the globe. And then also he was profiled in the documentary Stress, Portrait of a Killer. And so they went through how he's done his research over his entire lifetime, really, on baboons, looking at the effects of stress in a baboon culture where basically they have a dominant male and then the guy lowest on the totem pole has all the signs of cardiovascular disease. And this little baboon is not eating Big Macs.
Yeah.
So it's pretty interesting in terms of the destructive effects of stress. And he will commonly say, we're meant to be stressed for 20 minutes. We're not meant to be stressed out 18 hours a day like many of you are. And Dr. Rutherford and I have laughed over really the sad reality of the lifestyle of many Americans in terms of we wake up late, we get a coffee and a bagel or a coffee and a donut or a
after
coffee
we go on the bed late.
Yeah, a coffee and a high carbohydrate meal.
Watching David Letterman. Then we try to go to sleep.
And
we're wide awake because we're thinking about the jokes.
Yeah. And then in between there during the day, you're run. You go to work, then you get the kids, and you go home and you make dinner, and then you do whatever. After that, you're watching TV way too late. And it's just not a lifestyle that's conducive to good adrenal health.
Yeah, there are a lot of studies out there that would suggest we're the most stressed out society on the planet. We're probably more stressed out than the cannibals in New Guinea who fight each other and kill each other and eat each other's hearts and all that. It's like normal to them. But at least they go to sleep early and they get up and they eat whole foods and they're not too stressed about killing their fellow warriors. It's something that they embrace. So stress comes in a lot of different ways, and what the next where we're going to go and where Dr. Gates already went to is this fight-flight response. Everybody knows the adrenals as stress glands. I wanted to say this. One of the biggest, there are a lot of people out there who are practicing different aspects of functional medicine. There are maybe I would call a handful, maybe 400 board certified chiropractic neurologists. And I would say the vast majority of them are not doing what you're doing. They have the tools to do it, but a lot are not in this field. They're doing other things in the legal field, and they're doing examinations and and for car accident cases and things of that nature. But the program was designed for these doctors to be able to work with the brain, and when the brain is dysfunctioning, be able to get the brain back to functioning normally, and then have the symptoms that is a result of different parts of the brain dysfunctioning resolve or decrease. And one of the biggest challenges to both that, and one of the biggest challenges to what I do, functional medicine, is that stress response.
Absolutely.
It kind of screws up everything. And you might have just said, well, you just said he works with the brain, but I kind of see that as different. There's this brain that can go wrong and cause you dizziness, vertigo, balance, and a plethora of other things. But then there's the old brain, the automatic brain, where the fight-flight response is. And as Dr. Gates said, it's only designed for you to be in stress mode for 20 to 30 minutes. Think of an extreme example. Think of the little old lady who was walking down the street and sees her grandson under the car, and all of a sudden goes over, lifts up the car, the kid gets out from underneath, she drops it, and everybody looks around in stunned amazement. That is your fight, flight, stress response, and your adrenal glands working like overtime for a few seconds. Okay, now the big challenge, one of the reasons that we married our professions, is the big challenge to those of you who are out there trying to fix your leaky gut, or trying to fix your fibromyalgia, or with herbs and botanicals and stuff. One of the biggest saboteurs of that is this fight-flight mechanism. And if you are trying to do that and it's not working, and you're one of these folks who goes to bed, can't fall asleep, your brain's going a million miles an hour, you wake up in the middle of the night, you can't get back to sleep, your brain's going, that can be a couple things, but most of the time it's this fight-flight mechanism affecting your adrenal glands, affecting your blood sugar,
right.
and that's actually what's causing you to wake up in the middle of the night and not be able to go back to sleep. If you have that, you are going to have a hard time getting better of anything. And you can calm that down with drugs, but I think most people who are watching this probably realize that's not the best. Xanax for life is probably not the best long-term solution.
Right.
Although I understand why people embrace
Absolutely.
it. But those are serious drugs. They have long-term side effects. We don't need to get into that. But this is all about the adrenal glands. Okay, we're trying to draw the picture as to why people say if you can't fix the adrenals, you can't fix anything. We want to put that in perspective to those of you who have chronic problems, who have anxiety, even depression, a number of these things that the adrenal glands are playing a role in. And so let's talk a little bit more specifically about the function of the adrenal glands. You just talked about it a little bit. People who come in here and we're doing the evaluation, I do most of the consults to do kind of the patient selection process. Not everybody's right for our program. We'll usually figure out what's going on. I know that sounds maybe a little arrogant, but it's not. It's just this is what we do. We have a good paradigm of understanding of what we treat and what we know and what we don't know. But when we're done, the patient's usually going to have to end up doing what we ask them to do. So there might be a change in lifestyle, there might be exercise that have to be done, there might be dietary changes and things of that nature. And but most people come in here and they kind of know what cortisol is. Mm-hmm. They kind of know what cortisol is, kinda. Okay. So relative to this whole process of helping with helping the chronic pain or whatever you have that the adrenals might be playing into. Cortisol seems to be something that people have latched onto now. My cortisol levels, So why don't you talk about cortisol for a few minutes and how important that is to the adrenals, or how that's important to different aspects of the chronic problems that we see.
Okay, and I will. And I just want to preface one thing. There are chiropractic neurologists out there who do what we do.
I didn't say it wasn't.
Right, and you said it very eloquently.
I didn't say it wasn't. I just said it was a small percentage.
Yeah, it's just in my experience, a lot of my fellow.
You've been to the classes.
Chiropractic neurologists.
Well, I'm not putting that. I'm just saying that the people are going to start looking up chiropractic neurologists, and then they're going to call them, and then the guy's going to say, I don't do that. I do exams for for car accidents. I do independent medical exams, which a lot of them do. Okay, I'm not putting it down.
Yeah, I
I'm
know
just
you
giving
don't.
a perspective on if they start getting on the internet and looking up that, they'll go like, well, how come he does this and they do that? So there are others.
background.
There are others.
Yeah.
There are others. And frankly, this is what Dr. Carrick
This is what he intended, absolutely,
for the chiropractic
absolutely.
neurologist to do. But this is hard.
This is hard. It's very hard.
This is hard, and it's complex, and
From
so a lot of times people don't embrace that challenge to work with these types of people and do other things that the chiropractic neurologist is very skilled in doing. They're just not doing this.
Great point.
So, okay.
So, and going at that, early in the course of us treating patients with a variety of chronic illnesses and chronic neurologic conditions, we saw that if we couldn't fix the stress response, we couldn't help them because it was just so overwhelming. As Dr. Rutherford is saying, when someone is experiencing significant life stress, or maybe they've been through significant life stress and they're just maybe not able to let go of it, or their brain is caught in that pattern,
or they've had some bad
abuse problems, which we see time and time. It's nauseating how often. It's more than half of our female exams have been through sexual abuse in our patient population. So,
and verbal abuse and physical abuse, that gets in, and it just, without going in the mechanism, it just like doesn't go away.
Exactly. And basically it winds up that old part of the brain that you're talking about. And in doing so, this person is eliciting stress responses all the time, many times that they're not even aware of. We have a patient right now who's coming off of basically a benzodiazepine addiction, which is things like Xanax, Klonopin, those types of medications for all of you people out there who are under a lot of stress. And her heart rate will be sitting at 90 to 100 beats per minute all the time. And she's not even off the benzodiazepines. She's not off the Xanax-like medications.
Yeah.
And she said, well, why am I getting all these symptoms? Well, she is in a fight-flight state all the time. And she is a very smart individual too. So it's interesting having that interplay. But nonetheless, once that old part of the brain starts winding up, what you need to know out there about the adrenals is that almost every tissue in your body is being affected. If you're going to run from that line as fast as you can, your pupils are going to dilate so that you can see as many things as possible. The hair on your neck is going to stand up, of course. You're going to stop salivating. You're going to stop digesting your food because you want to get all the muscle from, or excuse me, all the blood from your visceral organs, your abdominal cavity, out to your muscles so they can contract as hard as humanly possible. And you're going to mobilize glucose from your liver because of cortisol so that your muscles can contract with enough energy, on and on and on. So basically it's a systemic response when we're under stress. And so many people are experiencing that. Now the adrenals are one tissue that are directly innervated.
And this is a big reason why people say you can't fix anything unless you fix the adrenals.
Exactly. Because the adrenals are one tissue that's innervated by the fight-flight response. And the adrenals do secrete hormones like cortisol and like norepinephrine and epinephrine, also known as adrenaline, that go throughout the body that mediate these effects. And cortisol is a very, very good thing in the acute nature of things. So basically acute meaning for those 20 minutes. Cortisol has a lot of positive benefits if you're running from the line. Cortisol is horrible when it's being produced too much chronically.
Right. Cortisol is perfect if it's properly produced.
Yeah.
And if it's too much, it causes a lot of problems. Cortisol, it's not coincidental, is when you have autoimmune diseases, when you have inflammatory diseases, what do they give you? Steroids.
Yeah.
They give you prednisone. These are all different aspects of cortisol. In a proper dose, calms down inflammation, calms down your immune system. But when it starts getting too much or too little,
for a long period of time, then it can start affecting all the tissues throughout your body. Namely, it can cause brain dysfunction. It can cause things like brain fog. They're now associating high levels of cortisol with memory loss. There have even been some research articles that we presented earlier in the year that talked about cortisol and dementia. We now know that, HIV patients, Dr. Sapolsky talks about this, they give them a huge dose of prednisone if they get a lung infection.
Right.
And half of them develop dementia in a couple of years, basically, because that cortisol is so powerful in not only many functions, but in those huge doses and chronic exposure causes your brain cells to basically degenerate, especially in the area thinking in the area of memory.
Makes it difficult to rest and digest.
Oh yeah.
We didn't talk
It
about
is the
that part.
antithesis.
The fight-flight syndrome is you're going to go into fight-flight, as Dr. Gates said, to fight the tiger or flee from the tiger, or pick up the car off of your little kid. You're in fight-flight, so you're put in that position. But then there's another part of this autonomic nervous system called the parasympathetic nervous system that's supposed to calm it down after 20 minutes. We talked about how it's only supposed to last for 20 minutes. Or what happens after 20 minutes? This other part of your nervous system is supposed to calm it down. And we have now come to call that part of that response, as opposed to fight-flight, the rest and digest. So for those of you who can't rest or can't digest, and you come here wondering why we're talking about your fight-flight mechanism when your gut is bad, that is a big part of what we see all the time. Yeah, exactly. And if you're in that 24 hours a day and you can't rest and you can't digest, you are in trouble. You are in trouble.
And that's a great point, because a lot of people don't realize that the fight-flight response trumps, in many instances, biochemically, the rest and digest response. So what is it more important? So you have the lion there, and you just ate a hamburger. Should insulin, to help you get the sugar from that hamburger bun into your cells, should that trump cortisol, or should cortisol, to get the sugar from your liver immediately to your muscles, should that trump insulin? And that is exactly the case. So cortisol, and especially adrenaline, completely shift your physiology such that you cannot go into a rest and digest state.
Yeah. Think of something that you've noticed, like stress 24 hours a day. Like my mom, as they say, God rest her soul, she's passed away, continually stressed. I mean, her face was drawn in. I mean, you look at it just totally, ultimately destroys tissue and destroys your system. It destroys your gut. It destroys your ability to absorb things. Dr. Gates made a reference to the fact that we found that we were doing proper neurology to the abnormal firing mechanisms of the brain. We have a whole hour on that somewhere on our powerhealthtalk.com website, so you can reference that if you want to know what chiropractic neurology and brain function is all about. But the bottom line is, at some point, we started utilizing simple procedures to see how they would respond to the nutritional aspects of what we do, the metabolic aspects, dealing with their endocrine system, dealing with the liver and the adrenals, and dealing with the thyroid and all these other things, if we started to introduce an in-office relaxation program. And the change in our results was substantial. And this is like the non-drug way of doing Xanax or any of the other anti-stress drugs that people are taking for a long time. Ultimately, though, the idea is to break that stress mechanism without those drugs, and that would be the ideal scene. But relative to what Dr. Gates is saying, we found is our results, our patients started getting much better, having much better results much quicker. And we're able to even utilize some of these procedures at home to maintain it relative to taking a drug. And there are even some good stuff out there. There are some good things that are non-drug supplemental support, but we even try to stay away from that when we can. So, so cortisol does a lot of damage. Too much cortisol messes up your brain. It messes up everything.
It messes up everything. It balances your immune system.
It screws up your
gastrointestinal tract to break down. I mean, it can
so if you're stressed,
to gain weight around the abdomen. The really interesting thing is this finding of functional hypercortisolism, which is a relatively new entity acknowledged in the literature, where they're now seeing that people without Cushing's disease. Now, Cushing's disease is basically where you produce way too much cortisol. You have a tendency to get this big abdomen that they describe as being pendulous, so kind of the Dunlap syndrome, where your belly has lapped over your belt. Also, it can cause purple striations because you get stretch marks.
I saw that yesterday from the gal we evaluated. She is stressed out.
Yeah, exactly. And they can get a hump, and they can get what's described as a moon face, because there's so much cortisol flowing throughout their system. Well, we're now seeing that many people have the same amount of cortisol as those with Cushing's disease, and they're now describing it as a functional hypercortisolism, and it's really seen.
So in other words, they got it without functional, meaning there's not a pathological reason for it. In other words, there's not a disease there, but they still have this crazy amount of cortisol going through their system without some diagnostic, documentable disease or pathology or cancer or tumor or something like that.
And this can be associated with polycystic ovarian syndrome and an inability to lose weight and just a myriad of things that we're talking about.
Yeah, how many, most people that come in here get that they have mental stress, but those that come in here who can't lose weight no matter what they try, for the most part, I find they're always shocked when I say your stress might be part of that. Because for some reason, most people think stress will cause you to lose weight. And I think it's because they have some concept of the person who's so stressed out that they stop eating.
Right.
That's
exactly.
But for the most part, those of you who can't lose weight, if you're stressed, it's probably contributing.
Yeah, absolutely. Absolutely. Well, do we want to talk about other causes of... we didn't talk about adrenal fatigue.
Well, okay, we can talk about that. Now, I was going to go relative to the other causes of stress. One of the things I would want to preface that with is saying everybody that comes into the office that I interview gets that stress comes from their mental stress. They're stressed. They've had a stressful event. Maybe they've had a long stressful event. We all went through this big recession. We have, so many people come in here losing their houses, losing their thing. Somebody comes in, they're very close to their parent. The mom died a year ago. They're still in a stress mechanism and so on and so forth. But I don't think maybe we should define before we go on to other adrenal symptoms, or maybe this is where you were going. Well, that's probably where you're going. Other causes of adrenal stress, because pretty much everything that goes on in your body causes stress on adrenal glands.
Great point.
Because ultimately that's going to help to balance out the blood sugar system and that adrenal cortisol levels. But they're pretty much, in my view, everything happens in your body that throws it out of balance causes stress on the adrenal glands.
Yeah.
That might be a little bit too global, but
I wouldn't necessarily say so. I mean, it's really interesting, especially we've talked a lot about fatigue lately. We've talked about chronic fatigue. We've talked about mitochondrial dysfunction. We haven't really done one on multiple intracellular infections. We kind of did with the mitochondria. But basically, a lot of our patients have autoimmune issues and neurological issues. And once someone gets an autoimmune issue, we're now seeing lots of times the immune system may be attacking the person, which it's never supposed to do, because there may be a bacteria in the gastrointestinal tract or a virus living in the body or a heavy metal somewhere in the body that the immune system is attacking and gets overreactive against us. Now, commonly in autoimmune conditions too, the immune system may not be good at clearing out these viruses as well, or these bacteria, and then therefore that can lead to things like fatigue. And because of that, the adrenals ramp up in their activity trying to sustain energy throughout the system. Or vice versa, you may have intracellular infections like mycoplasma, Lyme's disease, viruses, things of that nature that compromise the energy makers in your cells, termed mitochondria.
Yeah, if you have fatigue in our office, you come in here, it's going to be thyroid. We're going to look at your thyroid, blood sugar, adrenals, and your gut. And within the framework of those things, looking at a lot of things that what Dr. Gates is talking about, because every one of those things cause chronic fatigue. You can look at our chronic fatigue thing. It is not Epstein-Barr virus. It's not to say that occasionally that can't be involved, but it's what we're talking about right now. And the adrenals are a key player most of the time in the fatigue. They are not, and this is where I go, it's not the target, but it is part of the clinical picture of several of these chronic problems, and it's almost always, I would say it's always involved with fatigue, thyroid and adrenals.
Yeah, absolutely, because the adrenals are trying to basically lift up the house, so to speak. And whether it's thyroid, where someone may not have enough active thyroid hormone, whether it's an autoimmune attack against the thyroid, the mitochondrial dysfunctions we were talking about where they can't make enough energy, the adrenals try to lift up their activity. But the problem is, as we've talked about, a lot of people are in a chronic stressed out state. If you're in a chronic compromised chronic disease state, the adrenals can only do so much. The adrenals are not like a muscle where you stimulate them and they get stronger. Actually, the more you stimulate them over time, we see clinically they have a tendency to become weaker. And so lots of times they don't have enough reserves, and therefore production of adrenal hormones starts going way south. And then now, once the adrenals have gone, then the person oftentimes has nothing left to allow them to produce energy. And bringing them back is kind of an interesting...
And they're on hormone replacement therapy.
Continuous process, absolutely.
Because the adrenals make the precursors. For those of you who are females and are on hormone replacement therapy because you've gone through menopause, just for the record, you don't stop making estrogen after menopause. You make less because you need less. But if you're in this country and you're stressed out of your mind and you're eating crap and you're eating foods that are altered and a bunch of stuff we're going to talk about in a few minutes, that stresses out your adrenal glands. The precursors to you making estrogen and progesterone, guess where they're at? They're in your adrenal glands. Mm-hmm. And what we have found is a lot of times you fix these, well, you have to fix things we're going to talk about, fix the adrenal glands, and then the hormonal levels will generally balance out, and you have virtually no chance of that happening with hormone replacement therapy. So some of the nuances of the adrenals and their effect on everything.
And really all those things that we just went through are the other causes of adrenal symptoms and things of that nature, because so many people come in saying, I'm fatigued, or I'm stressed and I'm jittery and it's my adrenals, fix my adrenals, fix my adrenals, fix my adrenals.
Right. This is why we did this whole thing.
Exactly. Right here.
Which is what he said. It's all here.
Yeah.
Well,
in fact, I was the perfect example of that. So I was going through chiropractic school, stressed out of my mind, doing my neurology diplomate at the same time, basically going 7 days a week. And it got to the point where I couldn't sleep. It got to the point where I was just an absolute basket case. I was anxious, things of that nature. And so someone gave me adaptocrine, which is an adrenal supplement that we use, and I felt a lot better. Yeah. And I thought at that time, oh, it's not my blood sugar, it's not my gut, it's just my adrenals. Well, as time has gone on, I've come to learn so many other things involved: blood sugar regulation, gastrointestinal health, bacterial overgrowth in the intestines, food allergies, on and on and on, really were contributing to my adrenal problem.
And that takes me to another thing I hear from patients who come in all the time. I hear exactly that: fix my adrenals. Today, we're aware of the gut, we're aware of the food now, we're much more aware of food, we're much more aware the gut has problems, but we're still stuck on the adrenals of like, just fix this and fix that and fix this. But I would say that what Dr. Gates just got done saying is something that I share with patients. When I say that we're not alternative, I guess, it just depends on, it's a term, but what we look at ourselves as is kind of like, look, we've looked for what works. And if we have to meld with the medical profession for 20% of our cases, it's usually very little that intervention that we need, but we do it. But I want to make this determination. Okay, people come in and when they say, well, I don't want to take the drugs because I want to cover up the problem. Well, taking adaptocrine is kind of covering up the problem. Taking an adrenal supplement is kind of covering up the problem. Taking an adrenal shot is kind of covering up the problem, because look at all the things we have already cataloged that are causing your adrenals to go down. And I must say, I don't know if this is written anywhere. I don't know. I've never even discussed it with Dr. Gates, but the adrenals seem pretty darn recuperative to me. Mm-hmm. Like once you get your blood sugar right, whatever's attacking it, once you get the stress calmed down, once you get any of that, any of those factors under control, the adrenals tend to come back. I mean, that's kind of what they do. So in the end, we try to figure out as best we can how to do all of that, and really that would probably be our next and last topic would be. So in our world, taking adrenal support is maybe it's better. Yeah, it's better than taking a drug for it, for sure. But still, you're not getting to the cause of the problem. And again, one of the reasons I kind of bagged out, if you will, on nutritional intervention in my early career was hearing people say, I'm getting to the cause of the problem, I'm getting to the cause of the problem. People would be walking out with like a bag of supplements, and I'm thinking, that's not getting the problem. And the other thing that enlightened me at that point in time and regrouped my interest in nutrition was, even back then, I think I got the best results just simply by putting people on different diets. And I remember this one lady, she was so messed up, and I just put her on a blood sugar diet. And in retrospect, took her off of gluten by accident. Didn't even know what gluten was back then. And within 3 months, she lost weight, she felt better, her joint pain was gone. I was adjusting her for a car accident. She couldn't even hold an adjustment for like a day. All of a sudden, she didn't need adjustments anymore, So that all kind of cognited with me. And then when functional medicine started to come around and helped me, it all made sense. And then things started to get more in perspective. So the adrenal glands are part of the problem. But again, the point there, taking something for the adrenal glands is better. Maybe taking Taking an adaptocrine is definitely better than taking drugs to calm down your brain and so on and so forth, or drugs to take care of your diabetes type 2, which is really straining your adrenal glands and other things. But it's still not getting to the problem. And so that's what you need to do. And I think that's where we go to kind of finish this thing up. How do you get to the cause of the problem? You've mentioned a lot of things right now relative to what affects the adrenal glands. How, when a person comes in, let's say they come into us and they have fibromyalgia or peripheral neuropathy or chronic fatigue or whatever it is, the adrenal glands are frequently involved, but to different and varying degrees, in different and varying conditions and people, depending on their condition, depending on their stress levels, depending on what's causing their stress levels. So versus saying, I'm stressed, let me take an adaptocrine or Xanax or whatever, maybe you could draw a picture for the folks that are listening and or watching as to how you would go about their adrenal glands. And for those who have thyroid problems, this is a similar thing. People tend to come and go, it's my thyroid, and they're expecting we're going to go at their thyroid. Or it's my adrenal glands, and they're expecting we're going to go right at their adrenal glands with some sort of a supplement. And how would you explain to the patients how we go about that?
We look first at the gastrointestinal tract. From a variety of mechanisms. We look at what you're eating. Do you potentially have food intolerances? That's the best way to put it. You may think of them as food allergies, but they're really food intolerances. So if you're eating tomatoes and you're reacting to the tomatoes, as an example, that creates immune inflammation that could cause fatigue. We know many autoimmune disorders are associated with fatigue, like lupus, like rheumatoid arthritis, things of that nature. Well, we see that on a subclinical scale that can affect things of that nature. We also then look at the integrity of your gastrointestinal tract. So what is the bacterial and yeast culture of your GI tract made up of? Then we look at intestinal barrier function. How tight is that barrier, and is it really integritous or not? Then after that, if we can fix those things, we can kind of get a picture of, okay, by eliminating those things, what happens to the person's adrenal symptoms and also their overall immune health. Because as Dr. Rutherford commonly cited, that the thyroid is so frequently involved in these cases such that the immune system may be killing the thyroid and you may not know it, and that can be causing your fatigue too. And just keep in mind that we referenced a study last week on our Facebook post. 15% of Norwegian females have Hashimoto's thyroiditis at an extremely high level. We're talking an antibody count that is about 8 times higher than the antibody count used here in America. That's a significant proportion of the population. And so there are those factors. Then we look at possibilities of intracellular infections within the thyroid and other tissues throughout the body. We have to clear those out. Then we go in and we look at restoring the mitochondria, making sure that the mitochondrial membrane has a good barrier there, or is it completely trashed?
The little organs in your cells that create ATP, more commonly known as energy, mitochondria.
And then we look at how the adrenals are functioning after we clear all of that out, basically. That is our diagnostic.
Look at stress.
We do look at
toxins.
Absolutely.
Which, by the way, you didn't put down on our 11-point thing.
I thought I did. I didn't?
Well, we'll check it out.
Okay.
We're kind of putting together a little brochure on what we do, but we look at toxins. We look at all that, and there's just so much more within the framework of those.
Oh, absolutely. I mean, each one of those.
If somebody asked me how many things could affect the adrenals, wow, how much would you say? Just a number.
50.
I would probably say 80, but then I'm talking about the different autoimmune problems. If you smushed them all into one, all the different autoimmune problems into one, and just said an autoimmune problem, I would agree. Probably about 50 different things that are affecting your adrenal glands, in addition to the possibility of it just being an overfiring fight-flight mechanism that you got from a stress or a severe issue with abuse or something along those lines.
And then once we get to the adrenal glands, there are so many different modalities that we use. Some of you have too much cortisol, some of you don't have enough cortisol. Some of you, as Dr. Rutherford alluded to, have the brain firing problem. Sometimes that can be remediated through our brain-based exercises that Dr. Carrick really devised. Other times we see that the person may need a supplementation regime to calm down that area of the brain. Sometimes they need a medication, at least for the short interim. And we may refer them to a fellow or another doctor basically for that. And then also once we get the adrenals corrected with the brain, so to speak, then we can go in and try and repair the adrenals and give them the appropriate hormones or look at replacing the hormones. Some people with adrenal problems need to be referred to a medical doctor for hydrocortisone therapy, where they are basically given cortisol so that their adrenals can heal. Just think of a muscle that you've torn and you're trying to heal it, but you're continually exercising it. That's not going to work. It's not going to heal back fully and strongly,
right,
as if you just let it rest.
There are limitations to matter, meaning
Yes.
there's a limitation to, there's a point where even your cells or your adrenals can kind of quit, so to speak, and it's beyond the ken of a natural recovery. And a lot of times you can get the adrenals to kickstart by doing that.
Mm-hmm.
You may not need to take those medications for the rest of your life, but that's where we that's where we refer to intervene with our colleagues in the allopathic profession. So there's a lot there. As Dr. Gates said earlier, the adrenals, and they're not a lot of things that affect every single cell in your body. And the adrenals affect every single cell in your body, meaning that they can affect every single system in your body, whether it be brain and nervous system, or whether it be your entire endocrine system, in other words, your hormonal system. And everything in those systems can in turn affect the adrenal glands. And we're just, we're trying to put things out here that are going to make our life a little bit easier if people watch this and maybe have less people come in and say, no, I've been told it's the adrenal glands and I took adaptocrine and I felt better. And it's like, great, what are you doing here? It's because it's one of these other things. That was my little New Jerseyist coming out there. We do, because you have to look at it comprehensively. You have to evaluate the patient as a whole, as one entire physiological environment, and you have to find out everything that is affecting those adrenal glands and manage that if you want to have any fear of having a long-term result that doesn't require you taking a shot of a cortisol or adrenal glandular, or taking glandular or whatever every day for the rest of your life. So that's our point. You have one last point here, and I'm kind of curious about it. I'm not sure if I should mention it at this point in time.
It says evaluate the patient, not the supplement company.
Okay.
Just as I was under the impression of, it's just the adaptocrine brought me back.
Right.
And lots of times you as a patient have to be wary that supplement companies are pushing procedures onto doctors. Just like the pharmaceutical industry will push procedures.
Well, they're pushing the monthly popular
Absolutely.
thing of the month. We just got a big thing. We use berberine for certain things, and
Absolutely.
we just got a big thing from one of the famous alternative medical doctors out there who put out this big brochure on berberine and is going to fix everybody or everything, and it's going to help a lot of people with certain things. But it's no different than this. If you have intestinal bacterial overgrowth and you're killing some of those bacteria, you're going to have symptoms that are going to improve. But if you have that, I'm going to tell you something. You have a lot of other things going on that caused that. So what was the other one? A couple months ago, there was another one out on some supplement that if you eat, we have a lot of patients who are sensitive to gluten. There was another one out a couple months ago. Eat this. Don't listen to those doctors that tell you have to get on gluten-free diets and all this kind of stuff. Let me tell you something. If you have sensitivity to gluten, every time you eat it, before you get that supplement, it's killing brain cells. So you decide. You want to take that supplement, or you want to figure out, you want to stay off the gluten. So these are the types of things that Dr. Gates is talking about. We work with some very, very quality supplement companies, but we are extremely careful who we work with. We want to make sure that what's in them is what they say. I was just telling Dr. Gates.
And how does the patient tolerate it?
I was just going to say, we're very, very careful about even giving people supplements.
Supplements are powerful. They're incredibly
powerful. If you get good ones.
Yeah. And you can equally make someone just as sick as you can make them better.
And if you're sitting out there going, well, I'm taking this adrenal supplement, and I say, is it working? And you say, I'm not sure, it's not working. Because a lot of people at that point, that might seem like, commonsensical, but a lot of people are taking a lot of supplements, and I ask them, are they working? And they go, well, I don't know. You don't know. They ain't working. Well, but I read that I really need to take them because, I'm afraid to not take them because I'm afraid I'm going to get worse. It's like, if they're not helping you, if you're not seeing a change.
Right.
I mean, our supplements, we've fine-tuned. We work with some of the better supplement companies. I mean, we just did something, on essential fatty acids and fish oils a couple times. Of course, yesterday or a couple days ago, I had a gal come in and said, I'm taking fish oil. It really helps my knee problems. And we were saying, we don't really see a lot of patients that come in and say, I'm taking fish oil and it helps anything. So there you go. As soon as we said that, a week later, we have someone come in and she goes, I stopped taking it. My knees started bothering me.
Well,
so she should keep taking it. End of story. Don't go back and listen to us on that one.
But then she should also realize, why does she have so much inflammation throughout her system that she needs to take fish oil? She doesn't have a fish oil deficiency.
Maybe we should do a whole talk on that.
Yeah.
Maybe we should do a whole talk on evaluate the patient and not the supplement company.
That would be a good one.
Really, it would be.
It would be.
It would be, because we're not anti-supplements, we're not anti-drugs, but this is an environment that, when there's a product, the idea is how much can we promote this product, whether it's drugs. I do believe there are a lot more drugs being utilized out there than need to be. Or whether it's supplements. I do believe there are a lot more supplements out there being utilized than need to be. So the more supplements and drugs you have to take, well, drugs, people seem to be compliant with drugs because they're fearful to not take them. Mm-hmm. And they do seem to create effects because they're profound. But supplements, if we have patients who have to take too many supplements, their compliance level goes down. Yeah. And what that means is they don't do what we ask them to do. And so we've tried to understand what needs to be done and what doesn't need to be done. So we're not anti-supplements. Don't think we're just trying to bring clarity to you. And what we've seen we have to do to practically and clinically get people through protocols that will overcome the problems, the conditions, the symptoms that they've come in with, in a way that once they're done, they'll keep doing them so that they can stay better. Our goal here is not to have people coming in here for the rest of their life. Our goal is to figure out what are the 50 different things that could be screwing up your adrenal glands, which are the 3 or 4 or 5 that are screwing up yours, and then, or 5 or 6 or 7 or 8 or whatever, and then take care of those. Figure out what stage of function your adrenal glands are. Maybe you need some adaptocrine in the future, but our greatest hope is that you don't. That we get done. Your stress is under control. You have exercises for it, whatever. That your gut is in good shape. You know what your food allergies are. All the things that Dr. Gates talked about that we evaluate standardly in a case like that. And it's much more comprehensive than taking adrenal support. But long term, it's a much better. It's proven to be a much better solution for the vast majority of our patients. So.
Yeah, I think that's pretty conclusive.
Okay, that's conclusive. I am conclusive at this point in time.
Thank you for watching. You can find more videos on powerhealthtalk.com, and you can also message us on our Facebook page. And
any questions, any comments? We're not just here spouting off. We're looking to try to do something valuable for the public. So if you have any questions or any comments on what we do and how do you like to see us do it better, feel free to contact us at the same powerhealthtalk.com website. And thank you for watching. Hope that was helpful for those of you who are the adrenal fans out there.
Have a good day.